there. Thanks for watching. My name is Kristen Richmond. I'm the Volunteer Engagement Manager with 365 Health. I'm here today to walk you through a virtual model health fair. So we've just set up this health fair for the health fair that's happening tomorrow. Typically it's great to set up the day before. That way you can have everything ready to go the morning of your health fair. So the first station we're going to go through today is the volunteer registration table. So when you have volunteers come in the morning, typically they're showing up about an hour before the fair. You're more than welcome to stagger those start times if you have a lot of volunteers coming in. It's also good to have a specific volunteer to do volunteer check-in. Your planning team are going to be running around doing last minute things the morning of your health fair, and it's great to have one person that can stay in here and check in your volunteers. So it's good to have a list printed out of all the volunteers that either signed up on the website, or if you're doing your own manual tracking, having a list of your volunteers and their associated positions is crucial. Volunteers are going to come in, they're going to check in, you're going to check them off your list of volunteers. And then you're going to make sure they know that their protocol is sitting on the table, or if they're an ambassador, a floater, medical registration educator, we keep those protocols here on the table to hand to the volunteer that's doing that position so they can review it when they come in. So after you've checked them off your list, if they did not sign up through our volunteer website, we are going to want to have them sign the volunteer registration form. It has our volunteer commitments and values. We want to make sure they review that and then sign with their information. That way, at the end of the fair, you have all of the contact information for your volunteers, and we can all properly thank them for their time and their service today at the health fair. You're also going to want to have them get a name tag. It might be best to get them their shirts first and then have them come back and do their name tag. That way the stickiness of the name tag doesn't wear off before they have their shirt on. So I typically have the volunteer t-shirts separated by size. This is a change if you've run our health fairs in the past. We now provide all health fairs, not just the leadership team, with t-shirts. We want to make sure in that process you're asking your volunteers a t-shirt size so you can have everything ready for them when they get here. So hand them a t-shirt. In addition to getting their t-shirt, signing the registration form, getting their name tag, we also have pins that they can, PIN, pins that they can sit on their shirt. These are historically very coveted, so definitely encourage your volunteers to take one of those. From there, we're going to go to the volunteer break room. Okay, so now we are at the volunteer break room. So it's important to have a space at the health fair where your volunteers can go, replenish themselves, have a coffee, some food. So we do have a sign that says volunteers only. It is important when you're thinking about the break room and you're training your volunteers the morning of to be able to let them know that all food and drinks that's not a closed water bottle should always stay in the break room. Our participants that are coming to the health fair, a lot of them have been fasting. So we want to make sure to respect that and not be eating in front of them. So definitely, spoil your volunteers, have lots of great breakfasts in here. Some folks decide to bring in maybe to-go lunch or some pizza at the end of the fair if you're ending around noon, having them a nice lunch to leave by. But otherwise, coffee, bagels, fruit, having breakfast in here for your volunteers. That way when they do check in, they get their t-shirt on, they can come hang out for a little bit. And then it's important to make sure that you relate to your volunteers what time they should be at their stations to be trained for the day. Hello, so now your participants have come in the door. They've been welcomed to the health fair, and the first stop is going to be on-site registration if they have not yet registered for their blood screening. So they're gonna come to this table, and I'm gonna say it just like I would if you were a participant watching. So just so you know, each of the health fairs has their own participant registration form. This is what it looks like. So each one has site-specific numbers on there, so your site number will be listed on here, and then over to the side is the participant tracking number. So at the end of each one, that's how we keep track of how many participants are coming in your fair. So as you can see, all of these papers are connected and they are in order. So we want to make sure that as we're handing out these forms during the day, that we are keeping them in order by the number of the participant form. So what you're going to do is you are going to tear off the right side of this form. Tears off pretty nicely. You probably want to have a trash can here for the on-site registration volunteer, so that way it doesn't pile up. So if you were a participant coming into the fair, I'm going to hand this to you and I'm going to let you know that you need to fill out everything in the yellow. It's important for them to fill it out legibly. That's how we get their results to them. So everything in the yellow, they need to let us know if they fasted today. It is not required to fast any longer. It is completely optional, but it can be helpful for the lab to know if they did or did not fast. Here is an insurance question and an ethnicity question. It's helpful for them to answer that. And then here are all the lists of the blood screening. So they're going to go down this hallway and they're going to sit down at tables and they're going to fill this out. And I like to tell them that there will be medical registration educators in that area where they're filling out their paperwork, so that way they don't have to guess what screenings are right for them. So out on each table is going to be which screenings are right for you. I like to point this out to the participant. I like to have a sheet here and I can let them know to look for this on the table and to look for those medical volunteers that are going to help them. Sometimes participants bring in an order from their doctor, and those medical volunteers can help them match up which of our screenings is going to get them the right information that they need. Or maybe it's a conversation about their risk factors or their family history. We want to make sure that medical volunteers are the only ones that are giving that advice to participants. So once they get this form, I'm going to direct them to those tables where they start filling them out. I do like to keep masks here just in case that they want one, not required for our participants. And then we also have a joint privacy notice that we like to put on this table. Not a lot of people look at it, but if someone does want to see it, we want to make sure that this privacy notice is available for them to read. Wonderful. So now they have their form and they're going to come to tables that you've set out, so that way they can fill out their form. So on multiple tables, it really depends on how much foot traffic you expect to come into your fair. Typically, we're seeing about a 50-50 ratio between online registrants and folks walking in to register at your fair. So you want to make sure you have these which screenings are right for you sheets out on the tables, one side's English, one side's Spanish, so that way we can be accessible to multiple cultures. We also want to have pens out on the table. We want to have hand sanitizer at every single station. We want to make sure people feel like they can sanitize their hands in between touching public pens and things like that. You also want to make sure that you have a colon cancer educator in this area, or at least have a table before they get to the form check station. That way they can learn more about their potential risk factors for colon cancer or colorectal cancer. And they can also get their fit kit there. And then once they have filled out their paperwork, they've talked to the colon cancer educator, now they're going to go over to form check. So this volunteer, whoever you have at form check, you need to be a very detail-oriented person. Like I mentioned at the check-in table for on-site registration, how they fill out this top yellow form will determine how quickly they get their results or if they're delayed. So we want to make sure that the form check person, that they are reading everything here in the yellow, making sure it's completely legible, and also making sure that if they can't read it, they cross it out and they rewrite it in their best handwriting. So then at the form check, they're going to make sure that the participant signs and dates. Then the form check volunteer is going to witness. So they are also going to sign and date on the participant's form. The very last thing, if the participant is 65 or older and is on Medicare Part B, we also want them to sign at the bottom of the form consenting to that portion. Once they are done at form check, the form check person is going to send them to the cashier station. All right, so now the participant has reached the cashier station. So your cashier supervisor is in charge of this station, and our accounting team trains them separately. So I won't go far into detail on this, but the important things that you need to know are that when participants are getting blood work, or let's say they're just walking in for free services, they still need to go through form check, they still need to stop here, they still need to fill out this form. It covers them under our liability for being in the health fair. So we have record that they were there, whether or not they're paying for blood work or not. So once they get here, we have these nice square terminals now. We have upgraded into the 21st century. So we can take every kind of major credit card now. We can do Tap Pay, Apple Pay, Google Pay. We have been experiencing issues with HSA cards or health savings account cards through folks' health insurance. So if people come to the fair with those cards, they will most likely be declined and they will need to submit it for reimbursement. The cool thing is though, is those cards will work on our online registration system. So if you do know members of your community that have those cards, please instruct them to do online registration. It'll be a better end user experience for them. So they, at the cashier station, they're gonna look and see how many screenings they got. They're gonna total it up. If they're paying through card, they're gonna do it on the Square terminal. If they paid for a colon cancer kit on site, they're gonna hand them one of the Ensure Fit kits. There's 10 envelopes inside each box. So don't hand them the box, hand them an envelope within the box. In the box includes, in the envelope includes English instructions for the colon cancer screening kit. We have separate sheets for Spanish instructions. So if you have Spanish speaking participants in, you wanna make sure that you are giving them the information sheet in addition to their envelope. If we also have typically blood chemistry vouchers, some of our fairs have colon cancer screening kit vouchers. Those will all be taken here, shown on the form, taken off the total amount that they're paying. If they are doing it through cash or check, they will not be run through the squares. We'll do it the old-fashioned way on the paper. Once that's all done, the cashier is gonna keep the green sheet that's inside their participant form. So there is a top sheet, a white sheet, a green sheet, and a yellow sheet. So here they are keeping the green sheet and then leaving the participant with the white and the yellow copy as they go through the fair. All right, so there's two different types of registration at a fair. We just went through the on-site registration process. Now is the check-in for folks doing online registration. It can be helpful to do online registration. It's a faster check-in process when they get to the fair, and you can also save some money on our website by purchasing the blood screenings beforehand. So when the folks are coming to this table, they've already registered for your fair and they've already purchased and paid for their blood screening. So you are going to have a printout of all of your online registrants. It'll have their names, their pre-registration numbers. It'll have columns with ones for every one of the tests that they purchased. And then it will also have their appointment time. So anyone who registers online does have to choose an appointment time for them to come into the fair. So this online registration report is in order of appointment time and not alphabetical. If you need an alphabetical copy, please talk to your liaison and they can get that for you. So folks are going to come in, they are going to bring their paperwork printed out. So typically it's colorful, it has some red on it. So all of this that they would have filled out at on-site is already going to be filled out. There's already going to be X's where they chose their tests. So what you need to do is you need to get their paperwork, you need to find their name on the list, and then you need to mark them present. So ideally they brought this form. Once you mark them present, you are going to ask them how many hours they fasted. Again, not required, but helpful to include. So you're gonna write that down, and then similar to the other process, right? You're gonna have the participant sign and date, And then this volunteer, you will be the witness, much like the form check for the on-site. You will also sign a date. There's also a spot at the bottom for the same Medicare Part B. If they have it, they need to sign it. So once they have their form, you've checked them in. If they printed their form double-sided, you can always give them an extra copy of the participant copy. That way they can have their results put on their form for any of the free screenings that they're going to do today, like blood pressure or height, weight, BMI, things like that. So that is the first scenario of what could happen at the online registration station. Now let's say that your participant did not bring their printed out form. That's okay. Let's assume they're still on the list, so you'll still ask them their name, you'll find them on the list, you'll mark them present, and then there's another column that says no form. You'll also mark that. They have no form, but that's okay because we have extra copies in your online registration packet. Comes in a big gray envelope. All the information that you need is in there. So if they don't bring it, you verified that they paid because they're on your form. You're gonna have them fill out the top portion of their form, much like you did it on site. Again, hours fasting, and then you're gonna use the online registration report and the columns, and if it has a 1 underneath the test, that means they paid for it online. And you're gonna go ahead and put an X in the box for all of the screenings that they paid for. Please don't forget this step. Once they get to the lab area, if that wasn't done, the phlebotomist and that participant are gonna walk back to you to know what they need to draw for. So it's a crucial step. The other crucial step, if they don't bring their form, is each of these folks, like I talked about, has a pre-registration number. It begins with the letter O. So you are gonna write that O number right at the top of this little checkered box here. It's crucial that we do it. It's how we track our participants. It's how we get the results to them. Please don't forget that step. So once you filled all that out, you begin again, fasting, sign, you sign, they sign at the bottom if they need. So ideally, that participant interaction is going to go either one of those ways. Now let's say they either are not on the list and they didn't bring their form. So if they're not on the list and they do have their form, you can see that they still registered and paid because they have the form. They'll have a registration number at the top of the page, and they'll have the screenings that they paid for. If they have that form, it'll say right next to our doctor here, it'll say dash and then the site name. So right now we're at the Denver Indian Health and Family Services Fair. So it'll say dash the name of the health fair. If you see dash Quest Patient Service Center, I want you to find a 365 Health staff member or your site coordinator so that way we can get them transferred in our system to make sure that they can get their results on time. If anyone is not on this list, they must be listed then on our exception report. So on the exception report, anyone who's not on the list gets reported on here. The first column, you'll write that O number, the pre-registration number, then their pre-registration site, whether it's this one or Quest Patient Service Center, their phone number, participant name, and reason for putting them on the exception list. You could say registered for Quest PSC or simply wasn't on the list. It's really important in this station to note that if you cannot feel confident saying for certain that a participant paid, then you need to call over one of our staff members or a site coordinator to help you make that conclusion. That way they don't get to the lab area without having paid for screenings. All right, so now your participants have gone through either the online registration check-in or the on-site registration process. So now they are all ready to go to their blood draw area. So when they get here, they're going to have a phlebotomist, typically, depending on the lab supervisor. Some of them have little cues that they can raise in order to show the participant that they are ready to draw someone. It kind of indicates that they can come over to the table. So we'll have 2 chairs set up on either side of the table. Typically, two phlebotomists can share a table. Your lab supervisor will go through separate training, and they will learn how to set up everything in here, how to set up the centrifuge station. So that should be their responsibility during the setup. But just simply here we have the chucks on the table, all of the tubes on the table, the racks where they put their tubes. So everything should be set up for when your phlebotomists come in the morning. And then we'll also have the centrifuge area. It's nice to have a table with your centrifuges. Make sure when you set them up the day before that you have hooked them up to a surge protector or whatever you have, and that you run all of those centrifuges at the same time until they turn off. We want to make sure that it's not going to flip a breaker in the middle of your health fair if it's super busy capacity and all of your centrifuges are running at once. That can cause a poor effect on how we run the samples, and it could potentially cause some redraw situations if a breaker is flipped on that. So just go ahead and run all your centrifuges when you plug them in. Beyond the centrifuge table, it's also good to have a table to receive all of the samples. So you'll have centrifuge runners picking up all the blood samples off the table and taking them to a specific table to prepare them for centrifuge. Once they are done being in the centrifuge, you should also have a table strictly for packing your samples. And again, your lab supervisor will be instructed on how to properly do this, so that way when it gets back to Quest, they can run it as soon as possible. Also, in your phlebotomy area, you should have a first aid station. It's really critical to have this right in the lab area or as close to as possible. Whether it's a cot or a loungy chair, something that is easy in and out and comfy for the participant to lay or sit in if they're feeling faint, if they just are better at laying down while they get their blood drawn. It can be for quite a few reasons, right? So in addition to the cot, we also want to make sure we give them a little privacy. If they do faint, they probably don't want a bunch of people at the fair watching them. So making sure whether it's privacy screens, or you can see at this fair we did a makeshift with the leftover tables and their carriers and put the sign on the outside. However you can give the first aid area a little privacy, it's always nice. All right, so two adjacent stations to the blood draw area should first be your nourishment station. So in this station, we want to have crackers, we want to have juices, some water maybe. Always thinking about a gluten-free option to make sure we can serve everyone who comes at the fair. So you want to put this right as the participants are leaving the lab area. We want to make sure those folks that have been fasting, we get a little sugar, a little nutrition back into their bodies. That way they can continue on through the fair safely. In addition to the nourishment area, you also want to have a kids corner that's near enough to the lab area that adults can still see their children, because no child under the age of 18, so 17 and below, no one under 17 is allowed in the lab area. So we want to make sure that there is a dedicated place for them to hang out while their parents are getting their blood drawn. A lot of folks have coloring books, whatever you think folks that come into your fair will be interested in, please feel free to put it there. And then have a volunteer dedicated to the kids corner. That way no child is running into the lab area, there are needles there, and that is a safety hazard. We want to keep everyone safe while we're at the health fair.
Hi, my name is Lauren King. I am the Health and Wellness Medical Lead for 365 Health, and I'm excited to show you around some of our medical stations for fairs. The first station that we are going to talk about today is our immunization station. We offer flu vaccines and COVID vaccines depending on the time of year. And so for these immunization stations, the minimum number of tables that we should set up is 2 tables. Usually one for registration, paperwork, and then a second table at least for vaccinations. If you're anticipating a higher number of participants, a higher number of people who are going to come in for vaccinations, you may need to set up an additional table to have 2 different stations for actually vaccinating participants. Okay, now we're going to walk through how to set up a couple of the different medical screening stations. So this first one that we have available is free blood pressure and pulse screening. So at each of the medical stations, you want to make sure that they have a baseline of hand sanitizer, probably some alcohol wipes, and then the specific equipment that they would need for each screening station. So for the blood pressure pulse screening station, we need to get blood pressure cuffs, small, medium, large, all different sizes, and potentially even a child's cuff so we can accommodate every person who comes through, as well as the stethoscopes. You will be supplied with some stethoscopes, but we do encourage volunteers to bring their own if they have them. For each station, there will also be the screening protocol for that specific station. There should be a couple different copies of this protocol printed out at the stations for the volunteers to refer to. And then also at each station is the tally sheet for results on the participants. So the medical coordinator should set out the tally sheets for each station before, and then the medical coordinator should also be responsible for collecting these tally sheets at the end of the fair, just to make sure that we're recording each participant and their results. On the tally sheet, we should, before the fair starts, have the site name and then circled which station it's going to be at, so the volunteers, everything's ready for the volunteers to start screening participants. So for any participants that have a further evaluation score for any of their medical screenings, it's important to remember to refer them to the free Ask a Medical question or Get a Referral screening. There are medical practitioners at that screening station that can reevaluate blood pressures, pulses, anything out of the ordinary, just to make sure that we are fully evaluating a patient before giving them a further evaluation score on their paperwork. Okay, so to set up the tape measure at your height, weight, BMI station, usually there's going to be two sets of tape measures, one to measure waist circumference and one that we're going to set up to actually measure heights. So you want to make sure that you find a flat surface and then start this tape measure down at the bottom and make sure that it's flat against the wall so that we're measuring height as accurately as possible. Then this is the participant screening form. On the back, the yellow copy is the patient's participant's copy. So this is where we're going to be marking the results of our medical screening stations, blood pressure, height, weight, BMI, any other available screenings for them, so that participants have their results and can take them home with them. Okay, so for this next medical station, height, weight, BMI, we're just going to give you an example of how to measure someone's height. So we first are going to ask participants to remove their shoes so that we can get an accurate height. And then, depending on what tool you have to measure the person's height, we're usually going to stand them up against the wall here, make sure backs to the wall as much as they can. Oh, here we go, in front of it, there we go. And then either using a ruler or a piece of paper, something that you can measure straight back to see how tall they are. This kiddo is 51 inches tall. Pretty cool. So same as other stations, once you have evaluated a patient's height, then for this station we're going to evaluate their weight. Just have them take off their shoes, step on the scale, mark down the weight, and then in between participants, please wipe down the scale with some Clorox wipes or something just to clean the scale in between participants. Then following the protocol, you'll help calculate their BMI and mark either normal evaluation or further evaluation on the tally sheet as per what the protocol and participants' results show you. Okay, so this is our Ask a Medical Question, Get a Referral screening station, which the name of this station is going to be changed to Medical Education, Get a Referral screening station in the future. So you might see that sign instead of this. This is just a great resource for any participants who have questions, specific questions about their health, general questions about where to find providers or different places that they can get care. So setup to the station is very similar to the other medical stations. Always want to have some hand sanitizer set out, the different protocols for each volunteer, the tally sheets as people are coming through so we can do normal and further evaluation for their tallies. And then we also have the referral binders. There's a couple different versions. One of them is the children's binder, one of them is the English binder, and then the other one is a Spanish binder. So we have all sorts of resources for different health questions, and then different resources throughout the community that we can refer people out to different clinics, as well as just general education on health topics.
All right, so now we have reached the end of a basic health fair. So at the exit of your health fair, you want to make sure that you have a checkout station. This is also a nice place where you can thank our sponsors. If your health fair has community local sponsors that, donated food or coffee or help pay for more free screenings, if there are organizations within your local community that are helping out, we give you a separate blank sign so you can print out their logos and also show some love to your local sponsors as well. So the checkout station near the exit is a great place to show that off. So you want to have a volunteer stationed at your checkout station. What we want to make sure happens at this station is that no participant leaves with a white lab copy of their participant form. This white copy should be taken in the blood draw area if they got their blood drawn, or at the cashier station if they're just coming for the free screenings and not paying for any blood work. So first and foremost, no one leaves with a white copy. When they leave the fair, they should only have, drum roll please, there we go, their yellow copy, right? If they're online registration, then they have a white copy, but it looks pretty similar. They're gonna have their results from all their free screenings. So that's the most important job of this checkout volunteer. You can also have them do a few other things. Sometimes our 365 Health staff likes to learn more testimonials about why people like to come to the fair. Why is it important to them? What has the Night Health Fair formerly, or now the 365 Health Fair, what have we been able to catch for them and help them live their healthiest life every day of the year? So we want to make sure that we can capture those testimonials if it's an option at this fair. Another important task for this volunteer at the checkout station could be learning more about how people heard about your fair. You can have a short survey or just this volunteer asking and making quick tallies. However is easiest for you all to do it. It can be really helpful just for your future publicity efforts when you run your health fair again, to learn more about how people are getting and learning more about your fair and the fact that they need to come. So in general, that is how you run a basic health fair. If you have some other optional screenings, tabling organizations, you obviously want to have room for those within the health fair. And the only other thing I wanted to mention today is it's really important for all of your volunteers to be aware and have that collective knowledge of what all is being offered at your health fair. Whether it's through a map that you give participants and volunteers of what all is being offered at your fair, or a list of screenings as they come in. However you choose to do it, it's important that everyone within the health fair is aware, so that way they can direct participants. Oh, you're done with the blood draw. Have you seen these screenings over here? Making sure that all your volunteers are getting to interact with the participants. This knowledge can be especially helpful for our ambassadors that are walking through the fair, making sure participants are flowing through the fair properly. So if you have any questions, the volunteer engagement team is always here to answer them. Do not hesitate to reach out to us or your liaison, whoever is helping your team directly plan your fair. I hope you have a great health fair, and we're excited to have you.